Hello, ladies and gentlemen. Welcome to Mr. Coco's Nurses class. This hour, would like to look at a topic known as neonatal ophthalmia. Sometimes you may find that they've written ophthalmia neonatorum. It's the same thing. So when you look at this, there is what we call neonate or neonatal. So when you look at neonatal, like we've been talking about, we are dealing with babies 0 to 28 days. So 0 to 28 days, then what's the problem here? The problem is ophthalmia, meaning they've got a problem to deal with the eyes. So their problem is with the eyes, and they are 0 to 28 days. So those are neonates. So when you look at this topic, most of the times they do not ask you for an essay, but they ask you questions from this topic, just the word itself to say, maybe the definition itself. They want you to maybe fill in the blanks, where they would say what kind of infection affects the eyes of a neonate within 0 to 28 days. So the answer should be ophthalmia neonatorum or neonatal ophthalmia. That's what you choose. So you find it in MCQ section A or section B or C completion. That's where you find this. Then another important aspect is that you need to know just the anatomy of the eye. So when you look at it, you need just at least to be able to identify where the conjunctiva is, where the cornea is, okay, where the lens is, the vitreous body or vitreous humor. You need to know the optic nerve, the macula, the retina. So you need just to know at least those, okay? And then what about the maybe say where we have the conjunctiva here, what problems will arise in terms of complications. That's what I need to know about this. So most of the times the complications will arise from there and these other parts, but mostly the conjunctiva is highly affected, so you'll see the complications. So that's why at least you need to know some of these parts. Then when you go to the definition, in the definition, what you need to know is that the definition for neonatal ophthalmia is, you can put any words, but at least you should come up with any purulent discharge, meaning that any whitish discharge or any past discharge from the eye of an infant. So from the eye of an infant within 21 days, some would say within 28 days of life, and is acquired. So how does this come about? How should this infant or this neonate have an eye problem? How does it come about? How is it acquired? So it is acquired through an infected birth canal during delivery or through the vagina. So the infant's eye or the neonate's eye will sweep through the vagina, which has an infection. So we'll discuss the type of infection that you're going to find in the vagina or birth canal. So this infected birth canal, this is where the neonate gets the infection, because the infection will sweep, the eyes will sweep the infection through the vagina. So that's how they acquire it. Okay, so that's why we need to look at the eyes. So if you look at the eyes of this neonate above, so if you check above there, so you find that these eyes will sweep, okay? They'll sweep through the birth canal or the vagina and get the infection of the eye like that. That's what happens there. So that's what we'll need to know, that this is what happens. Then ophthalmia neonatorum, it's a form of what? Conjunctivitis. It's a form of conjunctivitis which occurs within the first 28 days of life, just like we have discussed. Then the baby contracts the disease, okay? Contracts the disease during delivery or during the process of delivery. Like I've explained, it sweeps through the vagina or the birth canal. So what usually comes here? Meaning that there will be swelling of the eyelids, in this case. When the infection occurs, there'll be swelling of the eyelids plus conjunctivitis, okay? That's why I emphasize on the conjunctiva. Then what organisms would cause neonatal ophthalmia? So when we look at the organisms, we've got Staphylococcus aureus. It can be in the birth canal or vagina. Then Escherichia coli can be there. Then we also have Neisseria gonorrhea, which can be there. Okay, then we have also Chlamydia trachomatis. So if you look at these, they'll ask you in one word answer, multiple choice, to say which one is the commonest, because these are sexually transmitted infections. So which one is the commonest cause of ophthalmia neonatal? The commonest cause, just like that, is Chlamydia trachomatis. If you go back to your papers again, you check to say which one is the most severe form of ophthalmia neonatal. It's the form which is caused by Neisseria gonorrhea. This is the most severe. So the most severe is Neisseria gonorrhea. The commonest is Chlamydia trachomatis. That's what you should know. So you find such questions in your past papers. Then what are the predisposing factors? When we look at the predisposing factors, we're saying that the baby contracts the disease during the birth process. That's what happens. And mostly the mother had untreated what? Sexually transmitted infection during pregnancy. So most of the times it's because the mother is not treated from that sexually transmitted infection or STI. So if that STI is not treated, meaning that during delivery or during the birth process, the infant will acquire the infection through the birth canal during delivery. Okay, so let's look at the signs and symptoms that we have here. Under the signs and symptoms, we have those which are caused by gonococcal conjunctivitis, which is gonorrhea. So if you look at these caused by gonococcal conjunctivitis, we are saying that it's the most what? Severe. The commonest is Chlamydia trachomatis. The most severe is gonococcal conjunctivitis or caused by Neisseria gonorrhea. So this will have what we call bilateral mucopurulent discharge. So meaning, in short, you just have eye discharge, both eyes. Mucopurulent meaning whitish eye discharge from both eyes. That's what you're going to have. And again, you're going to have epithelial edema, meaning that you find that most of the eyes are edematous, or the conjunctiva is edematous, and sometimes you can find sores in the eyes. These sores are what we're saying ulceration or sores in the eyes. That's what we can find. Then when you go to the next one, say for example chlamydia, what should we expect? So this will range from mild to scanty or with scanty mucoid discharge to eyelid swelling. So sometimes you might find that there's eyelid swelling, then the eyes are red, that's what I was saying, hyperemia. Then sometimes scanty mucoid discharge, meaning whitish discharge. Then other things that we can find can be chemosis. Chemosis are just simply blisters. So blisters can form in the eyes or on the eyelids or on the conjunctiva. So mostly the eyelid. That's where you can find blisters. Then eyelid scarring. So eyelid scarring meaning that maybe healing can occur, then it can heal by scarring. That's what you're going to see. So this scar tissue will be very hard tissue on the conjunctiva. So meaning that this is very bad for the baby. Then can have extraocular involvement. Extraocular involvement meaning that something that is outside the eye, because ocular is the eye, now something outside the eye. So the infection can spread to the lungs, bringing about pneumonitis. Can also go to the ears, bring about otitis, which is inflammation of the inner eye. Then can have pharyngeal colonization, meaning can go to the pharynx. So it can spread outside the eye. That's the bad part about this. Then other signs and symptoms. What are some of the other signs and symptoms? So we can have pain and tenderness of the eyeball because we know that there's scarring, there's edema, or there's inflammation in short. So that's why pain and tenderness will be there. Then there can be purulent and watery discharge depending on the cause, e.g. viral conjunctivitis. That's what happens. Then there can be swelling of the eyelid. You know there's inflammation, so the eyelid will be swollen. Then corneal involvement. The cornea can be involved, but it's rare that it's involved. Okay, so that's what happens. So if you look at this eye below, check out the eye. This eye is infected. So this is the pus. The one was saying mucopurulent discharge. So this is pus, which is being discharged. Then if you look at the eye, there is a hyperemia, meaning that this eye is reddish and the conjunctiva is swollen. If you look at the eyelids are inflamed as well. So this is what you're going to find. So what about the investigations? If we go to the investigations, what should we have? Okay, so if we look at the investigations, mostly it's history taking. So we can do what we call history taking. That's what we have here. So under history taking, what we have is the mother will give history maybe of vaginal discharge. When there is history of vaginal discharge, meaning you have a clue to say that the mother might have had an STI, then there can be history of untreated STI during pregnancy. So they can give you that history to say that there was vaginal discharge and it was not treated. So you might have a clue to say this might have been a sexually transmitted infection. Then what else can you do? To the baby, you can do a conjunctival swab. You can do a conjunctival swab, meaning you're going to swab more like there is that swabbing specimen bottle, which has something with a stick and a cotton wool. When you swab, you're going to get that swab and take it for culture and sensitivity so that you identify the exact microorganism causing the infection. Then another thing that you're going to do is a pen light examination, meaning that those pens or a small torch, meaning that when you get that small torch, you're going to examine the eye and it will show the damage to the surface of the eyeball with mucopurulent discharge. So it will just show outside. It won't show really the details inside the eye, but just what's on the surface of the eye, because you can't see inside with the pen light. Okay, then you have to screen the mother for sexually transmitted infections. That's what you're going to do. So mostly this deals with sexually transmitted infection. Then let's go to the treatment. When we go to the treatment, what you find is that if it's chemical conjunctivitis, if you have really done the investigations, you're going to just use preservative artificial tears. So there's what we call artificial tears. That's what we just put. So artificial tears will be 2 drops QID for 14 days, just to preserve the eye. So just put there so that the eye can clear. What about if you discover that after a swab, it's chlamydia or chlamydial conjunctivitis? What should you do? You're going to give oral erythromycin syrup for 50 milligrams per kg body weight per day, QID for 14 days. So you give erythromycin for chlamydia. What about if it's gonorrhea conjunctivitis? You're going to give a variety of drugs in this case. Okay, so these antibiotics are coming from almost the same class. So you have ceftriaxone, a single dose of 25 to 50 milligrams per kg, IV or IM. You can also give cefotaxime, a single dose of 100 milligrams per kg, IV or IM, or 100 to 150 milligrams per kg 12 hourly. Then you can also provide ciprobid or ciprofloxacin, 10 to 20 milligrams per kg per day, or norfloxacin, 10 milligrams per kg per day. So these are the treatment options that you have. What about if it's a viral conjunctivitis? So you use antiviral drugs such as acyclovir. Acyclovir 45 to 60 milligrams per kg body weight per day TDS in a full-term infant for 14 days. That's what you do. Then other supportive treatments, you can use TEO, which we call tetracycline eye ointment 1% QID, or TEO. And that's what you use. Then mother and her partner should receive an STI treatment and screening for HIV. That's what you do. So you need to screen them for STI, as well as you need to treat them for this STI, and then screen them for HIV, so that you protect the baby. Then what about the nursing care? Mostly we don't really admit unless it's severe, but we don't really admit. But if it's severe, then we can admit. But mostly these are treated from home. We just give the drugs, then they'll be putting there, unless it is severe. Then the aims are just to prevent infection and also to treat the baby and prevent complications, because the complications are very severe. You'll see the complications for this, they are very, very severe. Then the baby's eyes should be cleaned, and then we use mostly sterile water for injection, or maybe say normal saline or sodium chloride. Then we can also be putting a tetracycline eye ointment after cleaning. Then the baby can be nursed in maternity ward, neonatal unit. If the baby is born home, then is nursed in the neonatal isolation ward if we are admitting the baby. Then the environment should be kept clean and warm. So if we have admitted this baby, what should we use? We are going to use a prophenema. We're going to write all the details the way we nurse, just general nursing, which is a prophenema, if we have admitted. But if it's not severe, they have gone home, we don't need to write a prophenema, but you look at the scenario in case. Okay. Then what about IEC, or what we call health education? Okay, so let's look at health education. So under health education, we have just a few things that we need to do. Okay, we need to also teach the mother how to instill the eye drops as prescribed to promote healing. So meaning that for a baby maybe who's being discharged on these eye drops, or those who are not being admitted but are being discharged on the eye drops, you have to teach the mother how to instill, how to drop the medicine in the eyes. Then you need to also emphasize on breastfeeding. They need to breastfeed on demand, or 8 to 12 times per day. They need also to emphasize on review date. They need to come back so that they are checked up, so that they see whether the eyes have healed completely. Then in this case, you need also to look at immunization and growth monitoring. So you need to emphasize to the mother to be taking the baby for immunization, so that they receive all the vaccines. Then the mother should be encouraged to bath the baby. Okay, so bathing the baby is important, so that they keep the baby clean, and also as they bath, they clean the eyes as well. Then you should also advise the mother to wipe the face, or even just the eyes, with a clean cloth, so that the discharge is removed all the time. And then what water should they use? We use cold boiled water, okay, to prevent infection. That's what we do. Then let's look at the complications. The complications are very, very fatal. So if you look at the first one, which is conjunctival scarring, if not identified early and treated early, we can have conjunctival scarring. This is the damage of the conjunctiva leading to visual impairment, meaning that the child can even become blind, because the conjunctiva is going to be damaged if not treated early. Then let's look at the next one, corneal infiltration or perforation. So if the infection moves further and affects the cornea, meaning that there will be what we call corneal thinning and damage. So if the cornea is damaged, meaning that the baby will become blind as well. There can be many other complications, but mostly they lead to blindness, okay, or visual impairment. What about what we call corneal scarring? Corneal scarring, meaning that again we're looking at this microorganism that has invaded the cornea, and it is causing the cornea to become fibrosed or creating a fibrous tissue, meaning that this is something hard, a hard tissue that is being formed. So meaning that the baby's eye or vision will be impaired. Then also have blindness, which is mostly being caused by what we've discussed above. So what happens is that during this process, the optic nerve, okay, which is sensory, a nerve, will be damaged. And if it's damaged, meaning that the child will never see again. So this is bad as well for the infant or the neonate. Then we also have endophthalmitis. Endophthalmitis, we're looking at endo, which is inside. So endo meaning that the infection has now infiltrated the inner part of the eye or the inner cavity of the eye, leading to inflammation of the inner part of the eye. This is very painful, and this can damage the eye completely. So we need to ensure that the infection is treated as early as possible. So we've been discussing ophthalmia neonatorum or neonatal ophthalmia. So since we've talked about it, at least you have learned something. Kindly share the information and like the just click like if you like the presentation. Kindly encourage your friends to study as well and also to look at the information. You've been with Mr. Coco. Thank you very much for listening and have a blessed day.